New videos every day.
So my first tip is to take a breath with
Some problems with her hips, low back, I think hands and shoulders. We're going to start by working through here. Just going to give her a little
on an unwarmed up back without oil or lotion. And Corey already has some oil on her back, so that wasn't a entirely accurate representation. All right. Aligning your breath, whether with a client or a friend on the table, or with your romantic partner, or your child, or a family member, is a wonderful way to align and connect with somebody. If you literally want to feel close or closer to someone, breathing together is a wonderful way to accomplish that. So my third tip is to use your knuckles. Especially along the sides of the spine and down on the lower back. Corey, will you take a deep breath? For my fourth tip,
movement through the hips and low back. Now, if I bring her over using my leg, it means that I have an extra limb to be able to move her around and access some of this. Some gliding strokes, low and slow. She's breathing, probably because it's a little tight. And I'm going to go slow. Now, holding her in place means that since she was talking about her hips, her shoulder, and her hands, I'm going to try to work on all three at the same time. Her hip is getting some length, her shoulder is getting a traction, and I can work on her hand. Lengthening and tractioning through the fingers. Now I've got all this movement. I can go in opposite directions. One hand goes lateral, the other goes to, I guess, lateral as well, but the opposite side. Too sharp? Okay. Broad. How's that there? Okay. Now, if I allow her arm down, I'm going to use a little compression through the forearm here while I'm using the palm on this hand. Is it too much in the glutes? Okay, better there? There we go. When I ask for feedback, I often have to clarify because I'm making multiple points of contact. Holding through the forearm, long gliding stroke down through the IT band. And traction again through the palm. She's almost in a side lying position. This allows me to come in, lengthen through the shoulder, give her some support with my thigh. She's moving and mobilizing her own neck. So bring her through. I'm placing my knee right at the back of her rotator cuff. Is that too much there, Joy? Okay. She gave me a sigh. She didn't even respond. She's feeling good right there. How about there? Okay. Now, if I'm there, is that better?
Use your client's exhale when trying to access and address trigger points, knots, or tense areas. I'm going to take my own advice and repeat that with my knuckles. I'm using all right, so I've found the 2 tense spots, and now I'm going to invite Corey to take a deep breath with me. And as she exhales, I'm going to gently lean in. All right, honey, inhale again. And as she exhales, I lean out. Using the breath and going slow and gently, not ever forcing tissue, creates a sense of trust between your client or your friend's body and you. For my fifth tip, I want to encourage you to be as comfortable as you can. Keep your hips over your shoulders as much as possible. Because of the cameras, I can't practice proper body mechanics, but you feeling grounded and stable will help you give a great massage and also prevent you from doing anything silly like tripping and falling onto your client. Ask me how I know that could happen. Our tips were breathe with your client, do some warm-up strokes on a dry back before applying your oil or cream, use your knuckles, use your client's breath to address trigger points and knots. Finally, you, the therapist, stay grounded and comfortable. So what I'm doing now is one of my favorite moves. You make Miss Pac-Man hands and just grip with your thumb underneath the trapezius, just this one right here, and your fingers bracing on the shoulder blades. I don't know if you can see my body, but I'm tilting. I'm using my body weight. I'm kind of rocking back and forth. That's called petrissage. And I know one of my favorite moves is whenever anyone works at the top of my neck. And with your client laying face down, you can very, very gently work the front. Gently just rub the front of their neck.
I was a little bit too much to the elbow. Did it feel like I was kind of hyperextending the elbow just a bit? Just a bit too much. I backed off. There are 2 points of contact. My right knee is pressing into a rotator cuff. My left forearm is pressing down into our forearm extensors. And then slowly, I'm gonna maintain the contact with the knee. I'm gonna slide this guy out. I'm gonna back off just a bit. It was a bit much. There we go. Not too much on the elbow. Okay. Gonna give her a breath and work on the glutes here. Too much? Just tickles? Okay. To bring her back to center, she was almost on her side. I'm just going to grab and allow her to roll open. I'm going to reach my right foot underneath. You'll see that I'm not right behind the knee. If I'm into this popliteal space, it usually pulls on skin in a way that's mildly uncomfortable. The foot is just above in the hamstrings. And then my left foot is able to go right in front of the greater trochanter. There we go. To lengthen and toss her out. Right into gluteus medius, particularly. Gluteus medius faces out. She's breathing because that's fairly intense, right? Now how about if I hold right there? Feels good. Now, the additional piece is adding this guy in. So she's got some traction again. And I can do what? Work on her hip, work on her hand, and traction her shoulder, all at the same time. Right there. Through the palm, through the thenar eminence, tractioning the fingers. Right along this meaty junction from the pointer finger to the thumb. This guy right in here on both sides. Going in, working through there. And my left foot is just maintaining that pressure there. I'll reach around and mobilize. There are so many options. I make up new ones because when I'm working, it feels so much more effective to communicate with joy and work through tension than it does to follow a routine. Her breathing is still heavy. She's releasing. She's more aware of her breath than some people would be. She knows how to breathe from all of her yoga and acro yoga practice. Lengthening through there. Shake out the arm and then shake out the leg and then shake out both. Letting go. I can switch hands. I've pushed a little more with the left foot. Now, with the right foot, I'm actually going to resist. I'm going to pull her into me lightly. Is that too much? Okay, there we go. Just to give her enough. The ball pad of my left foot is where the pressure is being delivered. The right foot is just pulling the leg back and open. Side of her forearm, right through the forearm extensors. As she does this, she's trying to give me the finger, because that's what they all do, because this is one you pull the bowstring with, right? very tight in there, big and broad. I can reach the fingers in underneath. And then slowly glide out with a jostle. Now I've been pulling. What happens if I gently engage the arm and then push? Yeah, just give her some relief there. Moving around. Accessing the arm this way means that I'm moving the back, I'm moving the shoulder blade, I'm moving the neck, and I'm using her body against her. That's why the students kept saying my work reminded them of Brazilian Jiu-Jitsu. Now we're still doing multiple things at once. I'm stripping, I'm pulling through the forearm extensors, and I'm pressing into gluteus medius with my left foot. Now I'm going to see if I can return back to what we started with. I'm going to reposition her hips slightly because we drug her around the mat. And I'm going to see how it feels if we bring knee to same shoulder. There's a little tightness there. If I bring her arm out, I should be able to give her a little length, just mobility through the hip. This is influencing her pelvic bowl, influencing low back. And if she rolls a little bit more laterally, I can get more into the adductors here. That seemed like it was a little more relaxed, a little more what she was looking for. Yeah, just pinches. But just a temporary, yeah, everybody does that usually, right in there. Now, as I'm in, I believe this is gracilis. There's also adductor magnus and a series of other adductor muscles. I've got a broad pressure with my right hand, but I don't have to press as hard because her adductors have been lengthened as we've rolled her leg open, which means I can just hang out for a moment. Then I back off. Right into there. I can always reposition if I feel I need to. A lot of the movement involved in mat-based bodywork or Thai massage is going to be dictated by the size of your body in comparison to the size of the person you're working with. If Joy is 6'4", it changes the kind of work I do, just because of limb length. Again, holding through that right palm, I can lean in, just rocking a small amount of body weight. I'm going to back off. I'm going to take her out of my holster. Give her a little circle through the hip. Still catches. Let's see how it feels this way. Yeah. Now, when I bring you, knee to opposite shoulder. How's that? There we go. And then slowly hamstring stretch. Hamstring stretch. You'll notice that I lean in for 3 to 5 seconds and then back off. And then lean in for 3 to 5 seconds and back off. I'm going to give her a little pressure into her hamstrings. She feels tight enough. Aha! Right. So, too much in the hamstrings? Right there. I've softened my pressure by bending my leg. It means that I'm not delivering quite as much pressure, but she was tight enough that it was uncomfortable. So I'm going to back off. The real challenge in doing mat-based body work is not giving the client pressure. It's giving them the right amount, because I can easily overwhelm Joy. The challenge is she's not going to feel any better if I do. She just wants the right amount of pressure. And I'm going to vary this a bit. I'm going to bring her towards what looked like that little bit of a twist with my opposite leg. I'm going to reach over. You'll see how she wraps fairly comfortably. I've brought her into a half twist. I'm actually going to vary this leg so I have a little more room. I'm going to come over. My right leg is resting on hers, and I want to see now if I can reach in here. There we go. Now both feet are delivering a little bit of pressure. I can walk them along. She gets a little twist. More surface area means it's more broad, which means it's going to be less intense because it's not pointed. She was saying that just because she's stacked up, it feels like she's getting pressure from her body pressing into the mat. This isn't one that I commonly use in my practice, but she liked that twist earlier. And is it too much where I'm pressing there in the hamstring? Yeah. Now, we brought her over. I'm going to roll her out. And this time, I'm going to use both feet wrapped over my shin. I'm going to scoot in. I'm going to grab around the thigh. She was getting a toe caught in my pants there. Right there. I folded Joy's shin over my shins so that I can reach forward with my legs splayed out to be able to pull through her quads here. Sometimes I would reverse this sequence, but I can't really say in
Throat. Like don't go all the way to the front of their throat, but just the side of the neck. And once you've warmed up the back of the body, it's entirely appropriate to shift over to your forearms. This is a very simple forearm technique. I'm just letting my elbow drag up her spine. Let your elbow trace the edge of the scapula. And then just drag. And again, I'm using my feet and my back to give this move its power. In closing, I'm going to do a very gentle wide-handed effleurage.
My sessions, I follow a sequence anymore because Joy's tension is different than Mandy's, and Mandy's tension is different than Karina's. So as much as possible, I try to be soft and go with what the receiver seems to like. I'm going to roll out and putting her in what I call a kickstand. Instead of just tractioning the entire hip, I want to be able to grab. When I interlace fingers, I want to be able to grab into the quad and lengthen. If I don't like the hand grip, I can use forearms where you can see I'm grabbing and twisting, just for more surface area. Twisting. Then I'm going to grab gently and jostle back and forth. It's like I'm grabbing the quadriceps, rectus femoris, rolling that guy, vastus medialis, vastus lateralis. What is it, vastus medius, vastus intermedius now? They're not the quads anymore, they're the quints. Now they're saying there's an extra muscle. How's that right there? Is that too much? Okay. Grabbing, rolling that stuff back and forth again and again and again and again. To give her a little more pressure through here, I'm going to lift and see if I can stack. There we go. From the inside, I can change my body position to anything that feels comfortable. As I'm pressing with my forearm, this is big and broad. She's also getting some compression from my thigh on the opposite side. So I think about right there. Now in her case, because she talked about her shoulders, I'm going to see if I can continue working on this side with this hand. And then, at least for a moment, giving her a little twist the opposite way. There we go. Taking a break on the leg just to lean her over. My body mechanics aren't perfect from this angle, but this gives her a little something, a little twist. Back where we were. If I decide I want to change the position, there's a myriad options. I can back off, make sure that my thigh is in the crook there. I can line her up, which means that I can grab and traction. Not too much behind your knee. There you go. Can reach around. Traction and pull. Can even lift the quads if it's not too ticklish. They're stacked. Now, Joy, I want you to tell me, how does this feel? Too much? Just tender. If I continue doing this, the ticklishness will settle down, and sometimes I will use that in session just to give you an option. And there's the full tickle. So grabbing both hands, tractioning there. Lifting her up and over. I'm going to give some length again, kind of going back to what we did initially. Lots of playfulness. I love mat-based work because it feels like there are less limitations. There's no equipment to move around. I can move Joy in any position that we deem necessary to access something. Right through there. They criticize me on the YouTube videos for staring out the window, but I think that's because I don't want to stare at the model the whole time. Like, he was still deal with that guy. Right through there. Now, the quad is on this side. If I bring her leg up so she's supported, what if I grab and roll this way? Yeah. Which way? This way or back? Back, okay. Like that twist. Now, is that from my hands primarily? Yeah. Now, so it's not too much here? Okay. If I reach my arm around, there's this big long twist. It's like I'm rolling musculature, tissue around the femur. Into a relaxed tree pose. I'm able to approach the adductors again, but this time closer to the knee. I'm taking her in the hip from internal rotation to external rotation. Range of motion. Even if you don't know what those are called, even if you don't know the muscles, if you take someone through a range of motion, muscles cause movement. We're using movement to unwind those muscles. And again, a little bit of tree pose, right? Now, if I hold here, big long length. Just for a second, towards the ankle, towards the lower leg. Definitely not as bad. Both hands, big broad palm. When students ask me what to work on one of their clients, I just ask them what feels good to the client. If I can induce pleasure in the client and they feel good, they unwind. They feel relaxed, they feel calm, they feel nurtured, they feel supported. The adductors. Big, broad palm. Stacking my body in a way that feels comfortable. If it ever feels mildly uncomfortable, I'm going to shift out of it fairly quickly. And in addition, this reminds me to change position. Again as I release, right in towards the quads, grabbing that tissue, sliding it around, and then I will traction the hip just just to see how Joy responds. We've gone through a fairly broad range of motion. Too much in the calves. Just tender, yeah. And again, shoulder, one side, maybe the other, using the knee as a little brace. Always engaging movement. 9 times out of 10, I want to feel more than I think. Thinking leads to poor quality body work. Feeling leads to really great body work. The challenge is you have to be able to feel in session and out of session do your research. Doesn't mean I don't think. It just means that if I'm not paying attention to the subtle nuances of touch in a session, I think it detracts from the quality of the body work. The other thing is a cultivation of metta, or loving kindness. When I'm interacting with Joy or any other client, my internal presence and stance is one of helping them with their stuff. Pichette will talk about taking off their backpack. It's all their stuff. It's all the stuff they carry around, all their baggage. You're helping them open up their backpack and take all their stuff out. Pichette is a Thai massage master, well known in Thailand. Right through the forearm. Gonna stack again, slightly different angle. Going in slow. I don't have to say anything to clients about that sort of metta. Just something that comes across in the way I smile at them or treat them nice, ask them if they want a glass of water at the end of session. Just all the little things you do to be kind to people. Was that too much? You've got a shift there. So as I'm doing this, can you open your hand out for me? There you go. And then move it around. There. Then back into the palm again. Right into this junction. There's a little bit at that first dorsal interosseous right there. Lots of work with their hands. People in the acro yoga community, gymnasts. I'm trying to think, maybe guys who throw a javelin, other hand grip activities. Yeah, something where you grip baseball. Yeah. Right in there. Now, I'm holding maybe 50% of what I could do right there, and then I'm going to engage the other as well. Just like before, now I've doubled up. You can see that the fingers involuntarily moved as he went up the forearm flexors. I'm going to go for another pass. Pretty dense to that first dorsal interosseous. I'm going to back off and just move that guy around. That junction. Grabbing on both sides, just like that, right in there. I'm going to move the fingers out and open while I do that. Give her some motion. My stance as a professional who's dedicated 14 years to his work is that anybody can do great body work. Go slow, general to specific, superficial to deep. You can learn from these YouTube videos. Don't think that just because you're watching a YouTube video, you can't learn how to do this. Yeah, sure you can. Now, to charge for it, you need a license, and that's a particular piece of legislation. But to be able to do good massage, work on your wife, oh man, please take out the video, watch the video, work on each other, develop more intimacy and touch. Right there. Leaning and tractioning. Out through the fingers.
All right, Corey, will you take a deep breath with me? One more time, please. And so now, my second tip is to not apply your oil or your cream right away, and do some warm-up moves on the dry skin. You're able to actually go a little bit deeper.
Maybe the other. Using the knee as a little brace. Always engaging movement. 9 times out of 10, I want to feel more than I think. My internal presence and stance is one of helping them with their stuff. Pichette will talk about taking off their backpack. It's all their stuff. It's all the stuff they carry around, all their baggage. You're helping them open them up their backpack and take all their stuff out. Pichette is a Thai massage master, well known in Thailand. Right through the forearm. Gonna stack again, slightly different angle. Going in slow. I don't have to say anything to clients about that sort of metta. Just something that comes across in the way I smile at them or treat them nice, ask them if they want a glass of water at the end of session. Just all the little things you do to be kind to people. Was that too much? You've got a shift there. So as I'm doing this, can you open your hand out for me? There you go. And then move it around. There. Then back into the palm again. Right into this junction. It's a little bit at that first dorsal interosseous. Right there. Lots of work with their hands. People in the acro yoga community, gymnasts. I'm trying to think, maybe guys who throw a javelin, other hand grip activities. Yeah, something where you grip baseball. Yeah. Now, thinking leads to poor quality body work. Feeling leads to really great body work. The challenge is you have to be able to feel in session and out of session do your research. Doesn't mean I don't think. It just means that if I'm not paying attention to the subtle nuances of touch in a session, I think it detracts from the quality of the body work. The other thing is a cultivation of metta, or loving kindness. When I'm interacting with Joy or any other client, holding maybe 50% of what I could do right there, and then I'm going to engage the other as well. Just like before, now I've doubled up. You can see that the fingers involuntarily moved as we went up the forearm flexors. We're going to go for another pass. Pretty dense to that first dorsal interosseous. So I'm going to back off and just move that guy around. That junction. Grabbing on both sides, just like that, right in there. I'm going to move the fingers out and open while I do that. Give her some motion. My stance as a professional who's dedicated 14 years to his work is that anybody can do great body work. Go slow, general to specific, superficial to deep. You can learn from these YouTube videos. Don't think that just because you're watching a YouTube video you can't learn how to do this. Yeah, sure you can. Now, to charge for it, you need a license, and that's a particular piece of legislation. But to be able to do good massage, work on your wife, oh man, please. Take out the video, watch the video, work on each other, develop more intimacy and touch right there. Tractioning. Out through the fingers.
And then super gentle cranial hold. Gently holding the sacrum and the occiput. There's, maybe 5 grams of pressure here. This feels very grounding and balancing to the client and to me, honestly. And so I always hold until I feel the pulses even out between my hands. You may feel some warmth, either from your client's body or, coming from you as you do this move. It's normal, just breathe. Energy's moving. Thank you so much for joining me today. I hope you enjoyed this video. Make sure you check out the previous one in the series and the ones that are following. My name is Melissa Lemonian. To find out more about me, go to sensibletoolbox.com. And so now my second tip is to not apply your oil or your cream right away, and do some warm-up moves on the dry skin. You're able to actually go a little bit deeper on you. Take a breath with your client. All right, Corey, will you take a deep breath with me? One more time, please. Where I'll be showing you 5 tips on how to give a great glute and hip massage, great leg massage, 5 tips for the upper body and chest, 5 tips for the head and scalp. Thank you so much, and let's begin. All right. So my first tip, back without oil or lotion. And Corey already has some oil on her back, so that wasn't a entirely accurate representation. All right.